righty. To begin with, my name is Nancy Paul. The reason I am doing and hosting the International NASH Day is my mother, Cheryl VanBuskirk Auxier, died from NAFLD NASH Cirrhosis in 2015. She was diagnosed in 2014 with cirrhosis, and I about fell over to hear that because I thought that does not make sense with my mom. But it turned out she did. It was fatty liver disease, if any of you ever heard the term fatty liver disease. To begin with, I also would like to recognize Senator Mike Braun is aware that in Indiana, obesity unfortunately is a problem. And so one of the things that is a contributing factor to NAFLD NASH is obesity. So from Senator Braun's office, I would like to recognize Abby Gentry over here. She'll wave here. Because thankfully for Senator Braun, he has an interest in NAFLD NASH, and he has sent Abby here to help represent him and help with the education and awareness. The whole purpose of today is to educate the public and raise awareness, but also educate the medical professional, because unfortunately, there's a lot in the industry that are not familiar with NAFLD NASH, or they think it's just a mere, you need to lose a little weight and you'll be fine. But my mom is living proof, no, you won't be fine. It's a very deadly disease. My mom was, like I said, 74 when she was diagnosed, but she had actually been diagnosed for about 8 or 9 years with congestive heart failure and COPD that it turned out she never had. She went to our local community hospital that did not have a gastroenterologist on staff or a hepatologist, just the basic, regular GPs and some emergency crew. And she would get edema, she would get like itching, all kinds of different little symptoms. And so they jumped to the wrong conclusion that she had congestive heart failure from all the edema, she would get out of breath. But it was never her heart. Once we got her to Methodists here in Indianapolis in 2014, and they did a battery of tests, she did telemetry, she did echo, she did everything. And every doctor, the cardiologist would say, no, your mom's heart is actually working very well, and we can't find anything, right ventricle, left ventricle. But it was always her liver, and it was being masked. And the thing that was, the problem is so much of the time with medicine nowadays, honestly, is because everything is so specialized, they weren't connecting the dots. I took her myself to the emergency room one time. She was sitting at the kitchen table with me, and her nose literally started just pouring blood. She wasn't being active, she wasn't doing anything. Took her to the emergency room there in our hometown of Newcastle, and they presumed it was just dry weather, packed it, and they said not to worry. I called her physician that first thing because it was on a weekend. It was why I was home. I called her physician and I said, something's really wrong. My mom doesn't get bloody noses. And they were like, oh, it's no big deal. Well, actually, it was a symptom of her NAFLD NASH. I didn't know at the time. I knew something was wrong, but it turned out it was something majorly wrong because it was one of the indications that she had NAFLD NASH. The bad thing with liver disease is usually until you're very progressed in the disease, there's no symptoms. You feel fine for most of the time. Well, the NAFLD and your liver's, slowly starting to build up fibrosis. You feel fine. And it's not until the symptoms appear and you're really in trouble that you know something's wrong. Like I said, they diagnosed my mom with COPD. They gave her an inhaler. We would fight with her because she wouldn't use her inhaler. She goes, I don't feel any better when I use that inhaler. And we'd say, well, it's what the doctor said. You need to use it. It'll make you feel better. But it didn't. And the reason it didn't is she did not have COPD. She had what's called ascites, which is basically like the buildup of the fluids. And so it was pressing on her lungs. It was making it almost impossible for her to breathe. She, like I said, we took her to a dermatologist because that's what her general family doctor said with all the dry skin. Took her to a dermatologist. They gave her, cortisone or whatever it is to help with the itching. So what was happening is my mom was having symptoms treated, but she wasn't having the whole picture disease. And that's why I wanted to do an International NASH Day so no one else has this happen to their mom. The sad thing for me that will haunt me till the day I die is I actually was trained as a surgical technologist, and my plan was to go on to become a physician assistant, which is why I did the Surg Tech program, because I wanted to be in surgery. And so I knew something wasn't wrong, and I had a lot of friends in the medical profession. I would show them the lab sometimes, and I said, something's not right. I don't understand. And my mom would get so lethargic and so tired. One time I walked in the house, and she was peeling potatoes or something, and she was literally bent over the kitchen sink, leaning down, peeling potatoes. I was like, what are you doing? And she goes, I'm just so tired. Well, that was her liver disease, but I didn't know it at the time. She didn't know it. And so I live with the if-onlys, the what-ifs, if we had just known, but we didn't know. And so now I don't have my mom since July 31st of 2015, and I do not want that to happen to someone else. I'm very active with the American Liver Foundation. I do a lot of health fairs. I talk to people all the time that have never heard of NAFLD. And some of the risk factors for NAFLD, and Dr. Chalasani will be here in a little while to explain more of the medical terms and the risk. But people with diabetes, people with cardiovascular disease, obese people, people with certain metabolic conditions are certainly at high risk. And I talk to people that have no idea that are diagnosed with diabetes, and they've never been told about the potential of developing fatty liver. Like I said, with my mom, we would see things, but we did not ever understand what the implications were and why they were. It was always, something was wrong, but never the right disease. And so like I said, with my volunteering for the American Liver Foundation, I do the liver walk, I do health fairs, I'm very active on social media. I do everything I can to warn people so nobody ever, ever, ever dies needlessly if there's a possibility they could have saved it. If I had known my mom had fatty liver in the beginning, when we were, putting her on the inhaler for the COPD she didn't have, and actually we were counteractive in what we told her, because when she was diagnosed with congestive heart failure, well, somebody with CHF doesn't necessarily want to be really strenuous and active and exercise. So my mom, instead of exercising, which is a thing that she should have been doing, we kept her more sedentary, thinking, well, she's got congestive heart failure, so she can't get up and walk around the block and do all the things you need to do with fatty liver. And like I said, it eats at me every day that I didn't catch the symptoms, I didn't put the dots together, I didn't understand why my mom was getting tireder and tireder and worse, and nothing ever seemed to help her that we did. So that is why I came with the idea to have the International NASH Day. When I saw it last year for the first time on social media, it was a group of coalition of scientists, researchers, doctors, pharmaceutical companies, biotechs that had come up with the idea. So to start raising the awareness and the education that's so desperately needed. And I said, I'm going to do it. And so as the year progressed, I kept thinking, how do I do it? And I actually started making phone calls, emailed, and I emailed the city of Indianapolis. I said, what do I need to do? Do I need licenses? Do I need permits? What should I do? And I was told that I just, didn't need any of that just to get this. We could rent this. And then I wrote Dr. Naga P. Chalasani at IU Medical School, and he kindly agreed to meet with me, which I could not believe my fortune that he was willing to meet with me and help participate in International NASH Day. But he did. And then I'm also very active in social media, NASH support groups, NAFLD support groups, trying to find people to speak out, learn from them what patients are going through. Now I look back at some of the things my mom went through, and I never had any idea of the exhaustion and the confusion and some of the problems that happened with my mom. There's also a side effect once you get NASH, and then a lot of times when it progresses onto cirrhosis, there's something called hepatic encephalopathy, which will cause confusion and some mental alertness issues, sleepiness. I missed all of those symptoms, which I don't want anybody else to miss that. And then with her, she also had a condition called Hepatorenal Syndrome. A lot of times when you have the NASH, because you do get the fluid buildup, she would be on diuretics, what they call PRN. I weighed her every single day, and if she ever gained 3 pounds in one day, I was giving her the diuretics. She ended up falling into subacute rehab after a hospital stay. And with the hospital stay, they suggested that, they should go to the subacute rehab for physical training to get stronger before she came home. She fell in the subacute rehab. They didn't understand liver disease in her subacute rehab, so they just ignored when she fell, and it was when I walked in about an hour later, they had sent her on to physical therapy, and she ended up getting a huge bruise, the entire side of her left quadrant, and got her to Methodist Hospital, and they were hoping they could turn things around, but it ended up affecting her kidneys because it was already a concern with her liver disease. And then she needed dialysis, and then I couldn't get her into a dialysis clinic anywhere in the entire state of Indiana. And so that's why it's so important to be proactive, to know what fatty liver disease, to know what NASH is, NAFLD NASH, non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, to be aware of any changes so you can be proactive, talk to your doctor, because at this point, they're not normally checking for fatty liver, and it's kind of up to the patient and the family to be proactive and look for the disease. And so, like I said, by the time the symptoms, a lot of times are going to progress to the NASH cirrhosis. So if you see anything that's out of whack with your numbers, or you're just kind of feeling tired, you don't know why, your skin's yellowing, you're kind of itchy, you need to talk to your doctor. Ask your doctor, do you think I might have fatty liver disease? Do you think NASH could be a possibility? And open that dialogue. If you've been diagnosed with diabetes, cardiovascular disease, any of those things, you need to know if it's a possibility and be proactive with your doctor and check to make sure. Like I said, my mom probably had fatty liver. I don't know. They diagnosed her with a CHF like about 8 years before she died, so she probably had it, we'll say 10, 12, 15, 20 years before some of the symptoms started happening. And then, she went for so many years with having it. And once she was diagnosed, she actually was still at they have what they call a MELD score, and her MELD was only between 6 and then up to 12. And so it wasn't that bad, but yet because of her age at 74, she wasn't eligible for a transplant. Even though I had asked to be a living donor in my family, they didn't want to do the living donation at her age. And so that's why, like I said, it is just imperative to be aware of fatty liver disease. I was looking for anybody, hopefully to attend today, that was a fatty liver patient, NAFLD patient, or NASH, caregiver or family member. I know my father is over here. He's now grieving, missing my mom as I am. My brother is here as well. But I would love to see if anybody else by chance here has been affected by NASH. It doesn't appear that way. Well, hopefully now you'll be able to go home and talk to people about it, tell them about it, and it won't be an issue for somebody else someday to think, if only I had known. The recommended cure, because there is no cure at this point, so the only treatment for NASH at this stage is a change in lifestyle. So lifestyle is huge as far as diet, exercise. The recommended standard that I have seen, again, I'm not a medical professional, is 5 to 10% of your body weight. In reduction weight, they figure if you can reduce that type of weight and then maintain that weight, it will help turn your NAFLD NASH around. Unfortunately, my mom at 74, 75, she wasn't that good at exercising and turning it around, and at 74 she didn't really want to start, although she did go to physical therapy, occupational therapy, and was very diligent in doing everything she was supposed to. It was just the fall that changed that with the addition of the Hepatorenal Syndrome. But like I said, I know right now that all the pharmaceutical companies, the biotechs, every company out there is desperately searching and reaching to find a cure. But until one is found, the only thing that can help is the diet, the exercise, the healthy eating. The sugary foods are a huge thing. Everybody drinks sodas and all the highly sweetened things with the corn syrup, fructose. It might taste good, but your liver doesn't like it. It's not good for your liver, and your liver won't live a long time without it. But like I said, I would rather Dr. Chalasani go into the medical side of things because that's not my specialty. What I saw as a caregiver, once my mom was diagnosed, I actually quit my life, basically. I told my friends, don't call me, don't text me. I'm moving home to my hometown in Newcastle, Indiana. And I said I'm going to be with my mom 24/7 because she was always a fall risk. She could have fallen at any time. One of the things with NASH and the Hepatic Encephalopathy addition is she was a fall risk at any time. never after she was diagnosed was she ever left in the house by herself. My dad, my brother, or myself were always with her. I would like run to the market or whatever, because it was a constant 24-hour struggle with her cirrhosis. Cirrhosis is a cruel, evil thing, and I could not believe that we had missed it for so long, of how tortured she was. And I think it finally let her guard down once she had the diagnosis of NAFLD NASH cirrhosis. And I would have to help her do the smallest things because she would be so tired, just so winded, so exhausted. And she fought so hard to live and wanted so bad and wasn't given that opportunity. It wasn't there because it had progressed so far and with her age. So that's why now, with obesity and the typical things you think of with NASH, you don't presume it's in younger people. There's actually 1 in 10 children now that have NAFLD NASH, and 1 in 3 adults. So it's a very predominant issue, even in the youngest of people. I just was this weekend in Cincinnati talking to a pediatrics group at the Cincinnati Liver Walk, and they were saying that they see quite a few cases of NAFLD NASH coming through their pediatric program. And they said that, the one thing is when they present with NAFLD NASH, they don't fit the suspected obesity. They obviously, not a lot of times with diabetes from food-related diabetes over years of bad exercise and diet. But they said, they're seeing a lot of it in their pediatrics case. And so no one is immune. That's the thing, is no one is immune to NAFLD NASH cirrhosis. And the other really unfortunate thing, and I think the issue is why people didn't come from the NASH support group I'm in through the American Liver Foundation on Facebook. Like I've talked with people, I've driven all over the state the last couple weeks, going to gastroenterologist's office, different hospitals. I've also gone to nephrologists because the kidney patient with the diabetes is often the NASH patient. And I've left flyers everywhere. I've put them in every Starbucks or Panera's I could find, and trying to get people to come to share their NASH story. But what the problem is the stigma. People very mistakenly think of cirrhosis and liver disease of being a disease from alcohol or drugs. And certainly that's an issue to a certain degree, but nowadays with hepatitis C medications, it's really not a problem because it can be cured. And a lot of the boomers were in that range for the hepatitis C, but like I said, now there's medications and things that can be done, and drugs certainly can play an issue. But the number one cause for liver transplant at this stage is NAFLD NASH cirrhosis, and this is globally. Today, like I said, our NASH Day is one of about 50 across the globe. I know there's a couple going on in Pittsburgh and one in Arizona, and then there's some all over the world. The Global Liver Institute organization has been coordinating different pharmaceutical companies, doctors, programs in many different countries, and it's actually the Americanized diet of all the, sodas and the highly, the fructose and all the bad things that we do, and the sedentary lifestyles. Now everybody's on a computer instead of out exercising and working in the field like once upon a time. And so, like I said, I put this on as only one of, 50 plus International NASH Days, but it's because everybody around the world has realized it is a global epidemic, but yet nobody talks about it. And I think it's largely due to the epidemic, or the stigma of alcoholism and drugs. And it's so unfair because people like my mom are dying now because it's not a common household term or word or thought. And so that's why when I do health fairs or when I've been talking to people on the street here as we were setting up, I'll say, have you heard of fatty liver disease? And they'll say, no, not really. And it's my vision, my goal, my hope, my dream to make fatty liver disease, NAFLD NASH, a household name, term. Hopefully one day every doctor's office, every nurse practitioner, every physician assistant, every place you go for a physical, that will be something that they will just automatically look for, screen, talk to you about. Every nephrologist will talk to their diabetic patients about it. Every cardiovascular doctor will talk to their patients about it, and obviously every gastroenterologist. But at this stage, we're not there. And like I said, I've lived with my mom dying at age 75 for what I consider to be no reason at all. If only we had known to start her on an exercise program, to take away the donuts and the Cokes and give her fruit and water and you know, healthy foods, probably I would have my mom here with me today. And, you know, nothing would make me happier in a sense if I wasn't doing International NASH Day. I know that's selfish, but I would rather have my mom than anything in this world. And I don't have that. I never get to have that again. And so it's my hope that people will pay attention to the fatty liver disease, pay attention to this function, and then start one of their own, and at least start a dialogue with their family and with their physicians. At this stage, again, if anybody has a NAFLD NASH connection, would like to say anything, I would certainly welcome anybody else talking, joining the conversation. Nope. Has anybody else here at least heard of NAFLD NASH? You would like to say something? We have a guest that would like to say something.
Well, my name is Dr. Phillip Toth. I'm with Midwest Institute for Clinical Research. We're basically the only private research organization in town fully devoted to clinical trials. And a couple years ago, well, I'll start with a personal story. We had my mother's brother ended up dying of what probably in retrospect was NASH. He had progressive liver failure and ended up dying, even though at the time, which was about 10, 15 years ago, we didn't know very much about NASH or NAFLD at that point in time. But in 2017, we, besides Indiana University and Dr. Chalasani, we were the only place in town where you could get what we call a FibroScan, which people who are familiar with NAFLD and NASH realize it's a very simple bedside assessment for fat in the liver and stiffness or scarring without having to go to a radiology department. Currently, we've completed 3 NAFLD clinical trials, and also we're enrolling 3 additional clinical trials for this disease. And as already been said, it's important to realize that it's a fairly unrecognized problem, and unfortunately, just to kind of reiterate, our healthcare system in town and throughout the state, the healthcare providers are really fairly unfamiliar with this disease and really don't have the technologies or the knowledge to be able to treat this condition in a very regular or aggressive way. Hence, in the background, there are at least 30 to 40 drugs now in clinical trials, many of which are in the very early stages. There are several companies who have late-stage clinical trial of newer agents, but what's unfortunate is that even in our city and state, we are not, as a group, bringing those clinical trials availability to the general public. We happen to be one of those places, as well as Indiana University, but it would be very important if the clinical community would, as part of all the healthcare systems in town, whether it's community St. Vincent's, St. Francis, or IUHEALTH, would have their physicians, even though they're owned by the hospitals, to be a part of these new clinical trials, so we would have something for patients both currently and in the years to come. So I would really hope that everybody gets the message about NASH and NAFLD and spread the word. Remember that diabetes, being overweight, And middle-aged are some of the very well-known risk factors for this condition, and patients should be screened fairly early when one is either overweight or diabetic to find out. And it's too bad that FibroScan, as a simple office-based technology, can't be almost in every doctor's office throughout the city to begin to find out about the problem fairly early and to be very aggressive with diet, exercise, and weight loss, especially when we're in the early stage where we just have fat and without evidence of scarring, and way before it gets progressive. A lot of the underlying pathophysiology is also being worked out, and so hopefully in the next 5 to 10 years, we will have better treatments, because currently there is no, for the more severe NASH patients, we don't have any drug that's approved for use. There are several off-label uses of some drugs that have shown some benefit, but we definitely need those new medications, and it's going to just take a while for all this to happen. It's also important from a political perspective is that not just a lot of simple talk and support and interest, but our politicians need to take the health care in our state substantially more seriously. You know, we had Medicaid expansion, which was very slow. We're one of the fattest diabetic, heart disease, even within the surrounding states. We are well known to be one of the sickest ones. So we have to get public health funding, which unfortunately, because of the politics of our state, as represented by the slow implementation of HIP 2.0, which is still Medicaid expansion, that we need our politicians to take health seriously, invest in the health of our state, and it's not just the immediate thing. We need more money and support. Thank you.
Thank you very much. And now I would like to have Jennifer from research at IU come up and to say a couple words. She actually taught me something new today about fatty liver disease and some of the other conditions, so she's going to, I'm sure, share some valuable information with you.
Well, thank you everyone for being here and listening to us about this very important medical concern that, thank you, Nancy, for educating, doing your best to educate, because that's something I find. My background is I worked in transplant at IUHEALTH for going on 5 years, and then I was fortunate enough to be adopted into the liver research group. So very fortunate to work in a place where I feel like we definitely have the best doctors and staff for these type of conditions. And as a nurse and kind of a passion, I talk to a lot of people at the gym, at school, wherever, when they ask me about health. Most people really don't know how weight and diabetes, like they've said, can really affect your liver. They're often very surprised. They know it's going to affect their heart, their joints, that kind of thing. We're definitely seeing a rise in the number of people suffering from these conditions, along with the obesity trend. It's become, I believe, the #1 reason for transplant. And we see a lot younger of a population who are developing these conditions. So please, again, as Nancy said, spread the word. Keep in mind that eating right and exercise, sleeping well, stress reduction really can affect your whole health, and always love your liver. And I know that Dr. Chalasani is here now. So I definitely would cede the floor to him because he is definitely the expert. So, Dr. Chalasani.
So, where are the patients? All I see is just my staff here. I know, I'm just teasing you, Nancy. Wonderful job you have done. Great advocacy. So, Jennifer already touched on NASH. I just want to say a couple things. What seemed like a rare cause of liver disease maybe 20 years ago, now it's become the most common cause of cirrhosis needing liver transplant. And as Jennifer said, this is sort of driven largely by excess body weight, diabetes, and other things. So this is one that we intervene early. If you realize you have fatty liver in your 40s, you may be able to change your lifestyle, certain medications. You may prevent the disease getting all worse or going all the way up to cirrhosis and liver failure. So there is a lot of value in early recognition. So if you have your loved ones or your friends with fatty liver, they should not just blow it off. Instead, talking to their doctors about wanting more tests be done to see how bad it is, and maybe some special further testing can be done, maybe some special treatments can be offered as well. So what I'd like to do, though, is stop here and answer any questions that you may have, Nancy or others.
One thing I said I learned earlier today was that patients that have gastric bypass are actually much more susceptible then for developing alcohol-related cirrhosis. And I know most people nowadays want the quick fix on surgery, so if you could explain a little bit about that, because I would have thought gastric bypass might have been a good thing, and now I'm seeing it, if not done correctly with the follow-up, it could actually be more harmful.
That's a good question, Nancy. Gastric bypass for losing weight is, for the right patient, it is an excellent option. But the caveat, though, is patients who have had bypasses can have very sensitive to alcohol. Its simplest explanation is it just gets absorbed rapidly. So, people who have had bypasses, they get drunk quicker with smaller amounts of alcohol, and then also they get cirrhosis rapidly. So the rule of thumb for me is if somebody has had bypass, I tell them not to drink at all. So I think that's a good thing. But generally speaking, though, bypass, if it is done for the right patient, it can be quite effective in achieving weight loss, can also improving their outcomes.
Goes back to lifestyle.
Lifestyle, yes.
The other thing is, like with my mother being 74, 75, she wasn't eligible for the transplant. Do you see things coming on the future that, other than transplant, that might be in the weight loss? Like it's hard to get a little 74-year-old lady to lose a lot of weight. Do you see things coming in the horizon in the next year, 2, 5, whatever years?
In terms of weight loss or?
Other treatments besides just diet and exercise.
This is for NASH? Mm-hmm. Yeah, there's a lot of activity going on in the NASH space. So there are, for people with the NASH, there's a lot of research to see if we can prevent them getting into cirrhosis stage. There are probably 50 different medications that are being tested. I hope within next probably 5 to 10 years we would have a good medication for that. In other words, somebody has NASH and you give that medication, they don't develop cirrhosis. As far as somebody already has cirrhosis, and also I think it is a higher bar, more difficult, but like your mom, I think we hope to have a medication where at least somebody with cirrhosis, the liver will never become normal. It is just scarred liver, it'll always remain scarred liver, but at least you can keep it stable for a length of time. I think we have some tricks at the moment beyond weight loss. It could be vitamin E or taking some diabetes medicines. But I expect that there will be more medications that will become available over probably 5 to 10 years, not 1 to 2 year time horizon.
Would you suggest that if a patient has a diagnosis of NAFLD or NASH, obviously, that they should also just immediately look to finding a nephrologist and a cardiologist, since often, if you connect the dots, the NASH patient is a cardiology patient and a nephrology patient because of the diabetes and the comorbidities?
I'm not so sure somebody with NASH automatically needs a nephrologist, a kidney specialist, a heart specialist. But what I certainly think what you need is a combination of well-educated patient and highly engaged primary care physician. Because not everybody is going to have heart problems, not everybody is going to need a kidney specialist. But if you have the dyad, well-educated, well-informed patient, and then the PCP is really looking out, it's spending time to see what's going on, and I think that's probably what I recommend, rather than automatically. That would be the case even for a liver specialist. I am not suggesting everybody with fatty liver automatically needs to come to somebody like me, a liver specialist, but you really need is a very thorough internal medicine or a primary care physician who's going to look over, make sure things are lining up well.
Then if somebody had pre-diabetes and needed to lose some weight, do you think that they're in a high-risk category if they've been diagnosed with pre-diabetic and they know that there's a little bit of a cholesterol issue and weight issue? What do you think their odds are, and what do you think that patient needs to be doing?
I mean, the pre-diabetes is a big deal. There are a lot of people walking around with pre-diabetes. You leave them alone, just a matter of time, they become diabetic. Once you become diabetic, you may have lost the window to improve. So really the pre-diabetes is a perfect window where either you exercise or lose weight to actually become normal and also delay the onset of diabetes. And in terms of pre-diabetic patients, are there risk for fatty liver? Absolutely. If somebody with pre-diabetes has almost 5 times higher risk to have fatty liver compared to somebody without pre-diabetes. So I strongly encourage to be searched for pre-diabetes, and if you are a pre-diabetic, paying attention to it.
And then the one other question I can think of is, since my mother had NAFLD NASH cirrhosis and died from that, what are the chances that just a genetic component or, the heredity, what are my odds of developing NAFLD NASH compared to the average person?
I mean, this NASH cirrhosis, NAFLD runs in families, no question. We've seen a lot of families where there is clustering. The mother has NASH cirrhosis, the siblings have. But this is what we call a complex genetic disorder, meaning it's not like hemophilia. If you have the gene, you have 50% chance of getting it. This is more complex. In other words, I think there is some risk, but not 50, 60%. But it is also one that you can modify. In other words, it's not like hemophilia. You have a hemophilia gene, you're going to get it. There's really nothing you can do about it. Whereas NAFLD, if you have strong family history, you can do lifestyle modification, maintain your lead body weight and try to control your glucose. You should be able to prevent the development of NASH cirrhosis. That's really the story today about NASH is, if you take charge of your lifestyle, if you're in the right window, you should be able to prevent the development of cirrhosis and liver failure. That's really the message I want to say here.
Does anyone else have any questions? Anybody?
Thank you so much.
Thank you. Well, at this point, unless anybody else has any questions, I can't thank Dr. Chalasani enough for coming today. As I said, this man did not know me from Adam. I wrote him a letter and thought he's going to probably think I'm some kind of crazy kook, which he probably is right on that anyways. But he graciously had his assistant contact me and agreed to a meeting and agreed to come here. And it just proves that he is in medicine, and we are very fortunate that he's in medicine because he's in medicine for the right reason, to help and to educate patients. And for that, I am eternally grateful. I'm hoping that this is, in a sense, the last International NASH Day. but I have a feeling it won't be because I don't think NASH is going away anytime soon. But that is my hope and my dream. But at this stage, I hope that somebody's at least gained a little bit of information, a little bit of knowledge. It starts a conversation at the dinner table or with your general family physician. And NAFLD NASH Cirrhosis is at least going to get a little more attention and education because, as Dr. Chalasani said, right now, the lifestyle changes of diet and exercise are the only cure and hope, and it's also the best way to prevent it. But without awareness and education, that's not going to happen. Everybody kind of knows they need to eat healthy and exercise, but if they know that there's a strong risk potential for developing a disease, then hopefully that will inspire them to get out there and exercise and do all the things they need to do. Because I can tell you, NAFLD NASH is extremely deadly because I don't have my mom because of it. And like I said, I live with the if-onlys and the what-ifs every day, and I never, ever want somebody else to go through what I do every day. So thank you very much for everybody for coming. I certainly appreciate Dr. Chalasani, our kind nurse from the research department, and everybody for attending. Thank you.